Hello, this is Dr. Hugo Gonzales, and this is your program, Insight. Thank you again for joining our Insight YouTube channel. Please, if you like some of the issues that we discuss here, please give us a thumbs up. Today we are going to talk about play therapy for children. So why play therapy? So play therapy is a therapy specifically designed for children. It utilizes play as a means of communication and expression, and it is going to allow children to explore their thoughts, feelings, and experiences in a safe and supportive environment. Let's talk about some of the main issues that are going to be associated to play therapy with children. So, what will be the purpose of us working with play therapy? As we indicated before, play therapy is going to allow children to express themselves. It's also going to allow them to process difficult emotions, develop problem-solving skills, and most importantly, is going to promote healing and growth. However, one of very important elements in the play therapy work with children is the therapeutic alliance. So what is very, very important is for the therapist to build a safe and in time a trusting relationship with the child, which is basically the foundation or the building block for any kind of therapy. So the role of the therapist is to build a safe space where the child feels comfortable and able to explore and express themselves through their play. As you may also consider, there are a number of play materials that are going to be used in play therapy, so such as toys, art supplies, puppets, and games are going to be provided to encourage self-expression and creativity. Children are going to be free to choose what they want to play with and how they want to engage with the materials. And that they are also going to be very important elements in the process of learning what is going on with the child. And as you can also see, because the child is going to be self-selective, the approach that we are going to use in working with play therapy and in working with children is going to be a non-directive approach. So basically, we are going to allow the child to lead the play process, the play session, and our role will be to observe, reflect, and occasionally provide some insights regarding the child's play. But the focus is mainly going to be on the child's self-directed exploration. Because at the end of the day, there is a symbolic expression, is expression of their feelings, inner thoughts, and experiences that they have gone through. For example, they may act scenarios with dolls or use art to depict their emotions. Play therapists are going to help children to understand processes and their symbolic expression. So our goal in therapy is to facilitate in time emotional regulation, keeping the with the self-exploration, the child is also going to develop the skills in problem solving, develop a new learning in terms of social skills, and most importantly, self-awareness and resilience in dealing with circumstances and situations in their life. So as we are going to use play therapy in many, many, many different situations with children, including anxiety, trauma-related, some behavioral difficulties that the child may find, if the child is experiencing grief, and many, many, many more different conditions that the child may present. So the child therapy, child play therapy may take may take a few sessions, and of course may also the extent of the child play therapy may be also related to the particular needs of the child and particular needs of the therapeutic process and the goals that we are trying to achieve. Some children may benefit from short-term interventions. However, because the issue of feeling safe and trust is going to be a very important issue, we need to acknowledge that in many cases, child therapy is going to be a long-term process. Here in our practice, we make sure that play therapy is conducted by licensed and trained professionals who have a specialized training and experience in working with children. So they have certainly the expertise to create a supportive and therapeutic environment for children to heal and grow. Thank you for being part of this session with insight. I'm hoping to see you soon. Thank you very much.